In the ER, it's always a chaotic environment, even if it's controlled chaos. You never know what's going to come in. This causes a lot of stress on us as nurses. We don't eat lunch, we miss bathroom breaks. This nurse well-being program helps us to know that it's okay to prioritize our needs, and that if we're at our best self, then we can take the better care of our patients in the long run.
We weren't really sure how people were going to take the program. It turns out, statistically speaking, like 88% of nurses agreed with the program, saw that it was suitable. Did the trainings with them throughout the months, showing them like what it all included as far as putting a name to a stress continuum, seeing if we're at our best, seeing if we're burnt out. And now that we have like a name to it, people are saying it like, oh, I'm feeling a little red today, or I'm green, I'm ready to do my job. That also gives advice on how to actively listen to people around you, using the little phrases that like, I understand how you feel, or I'm sorry this has happened to you, like showing people that you care.
It just makes us more aware of our coworkers, and we feel more comfortable talking with them too if we notice something's going on with them.
Connecting with each other to support one another to get through the daily stress of the environment. That's one of the biggest things I've taken away from this program. My turnover has decreased over the last year. I've actually had to take nursing positions down off of our website that had been up there for over 3 years. Things like that show me that our team is working together, and things like this have made that team stronger and more united.
The American Nurses Foundation received a grant from the United Health Foundation to develop a program using the Stress First Aid model. And we were able to partner with 4 pilot sites across the country to help us develop that program and to test it at their organizations.
American Nurses Foundation reached out to us and said, hey, we see that you're really interested in addressing stress. We really want to involve you in this. Would you be interested? And of course, this was something that we were already passionate about, that we were already wanting to address with our hospital system, and we couldn't pass it up. Really what's allowed us to grow it across our hospital system has been a collaboration from the ground up, from the nurse champions to the managers. It's been a beautiful thing to see everyone kind of jump in and say, this is important to us, and say, hey, we really want to see our nurses not just survive, but to thrive.
Here at University Hospital, we are a level 1 trauma center, which means that we're going to get the sickest of the sick along the Gulf Coast. So there's never really a day where you have a down day. There's really never a day that those helicopters stop landing. The biggest message that we wanted to get across to our nurses was that we see them. You know, we see them as individuals. We see them as that person first, a nurse second, and that we want to give them the very best tools to be successful both in their personal life and in their professional life.
By rolling this out through the organization, it helps us as healthcare workers to be better. The resources are free, it's easily accessible. It's definitely new and exciting territory for us. We have a lot of new nurses as well coming out of school, so if we are able to outfit them with these tools while they're new grads and they're still developing, they can take all of the tools about managing their stress and apply it wherever nursing takes them in the future.
I've asked a few coworkers, like, how do they feel about what we're doing? And they said that even when they're not at work, whenever they're ready to come on to their next shift, that they're actually looking forward to come to work, because now they have an outlet to actually stop and pause and not be stressed out the whole entire day.